Many of the coronavirus cases and deaths are in Missouri and they're in the St. Louis region. Now, 4 of the area's top healthcare systems have formed the St. Louis Metropolitan Pandemic Task Force, along with local officials and health departments. It's a concentrated effort to stop the spread of the coronavirus. News 4's Caroline Hecker spoke with the doctor leading the task force about the challenges still ahead.
St. Louis Metropolitan Pandemic Task Force says based on current data, it estimates the peak of COVID-19 cases will hit the St. Louis area in about 2 or 3 weeks. But the current lack of personal protective equipment and testing is making this fight even more of an uphill battle. Leaders of the region's major healthcare systems and local elected officials are pleading with the public. Stay home and stop the spread.
There is no shot, there is no pill, there is no medicine. It's just our behavior.
The Pandemic Task Force will work together to coordinate supplies, hospital beds, and patient care in the St. Louis region. But those supplies are difficult to come by, according to Dr. Garza, the incident commander of the task force. He says there simply isn't enough personal protective gear to go around.
We literally scour the earth looking for personal protective equipment. And when I say that, I am not kidding.
He says orders have been placed, along with every other hospital in the country. As a result, he says many healthcare workers are forced to reuse personal protective equipment. Right now, the 4 healthcare systems have their own supply chains, but will pool supplies if one becomes critically low. Testing kits are also hard to come by. Garza says the number of tests pales in comparison to the number of people who ask for one.
We would love to have unlimited testing, both from a clinical perspective and from a surveillance perspective. But the reality is we just don't have enough right now.
At the end of the day, Dr. Garza says the name of the game is stopping the spread. Without that, he says the burden on hospitals will continue to grow, bending all they can until they break. In West St. Louis, Caroline Hecker, News 4.
St. Charles County Executive Steve Almond says the threat remains real, not only for his county, but for Jefferson and Franklin counties as well. He says based on data gathered in his office, he believes the 3 counties are about 6 days behind St. Louis City and St. Louis County on the coronavirus curve.